Hi, my name is Chris Moore. I'm the chair of the Nevada Diabetes Council. I also run the Adult Diabetes Education and Management Support Group, and I'm the co-host of the popular podcast DiabetesPowerShow.com. Today I'm going to talk to you about your hemoglobin A1C number. The hemoglobin A1C, some have equated this to your quality of life number when you have diabetes. Some have even compared this to the speedometer in a motor vehicle. However, today we're not talking about a motor vehicle, we're talking about you with diabetes. What we're really trying to control is the speed at which you are speeding out of control towards diabetes-related complications. So if we control your hemoglobin A1C, we can prevent certain diabetes-related complications such as eye problems, heart disease, kidney problems, and problems with your nerves. What exactly is hemoglobin A1C? Hemoglobin A1C is part of the red blood cell. Usually hemoglobin is the molecule that carries oxygen to all your vital organs. However, in this case, we're talking about the hemoglobin A. And more specifically, this hemoglobin has an attraction for glucose. When this glucose is attached to this hemoglobin A1A, we call this the hemoglobin A1C, or glycosylated hemoglobin. We measure this within percentage points. So if the molecule is 6% saturated, we would say your average blood glucose is about 135 milligrams per deciliter. If it was 7% saturated, we would say it's 170 milligrams per deciliter as your average blood glucose. If you're trending upwards and you're speeding out of control and you have a 12% hemoglobin A1C, we would say that your average blood sugar is 345. As you can see, if you have this kind of blood sugar, you really truly are speeding out of control towards diabetes-related complications. So please, get your hemoglobin A1C checked at least every 3 months by your healthcare provider. We do know that the hemoglobin A1C by the American Diabetes Association standard should be less than 7%. However, the American Association of Clinical Endocrinologists believe that this should be less than 6.5. But really, truly, this is up to your healthcare provider to know what your target range should be. So please, make sure that you know your numbers, control your diabetes, and ensure that you will never speed out of control for diabetes-related complications.